Morning guys, I hope we're all sparkly. As you may have noticed, I've taken a little bit of a break from social media. It's a poisonous, narcissistic, destructive environment, and I've had to concentrate on the task at hand, and that is looking after my patients and developing a pathway for guys with traumatic brain injury and complex PTSD with Mandy Bostwick, who is a specialist trauma psychotherapist. So we are super enthused to be working with her. But I was shown a video by the bozos last night, and I thought I'd better do a response video. Every time I try to get out, they bring me back in. Is testosterone replacement therapy for life? This is a very short video. The answer is yes. Testosterone replacement therapy. It should only be prescribed if you have a confirmed testosterone deficiency. Now, there are British Society for Sexual Medicine guidelines that help clinicians make the diagnosis, but that concentrates on the quantitative markers necessary to establish a diagnosis. That does not necessarily mean that TRT is in your best interests. You need to look at reversible causes. You need to look at what you can do to affect a positive change to not only your testosterone level, but your overall health, because it comes part and parcel. You need to look at whether there are some lifestyle issues that you can address. Most importantly, sleep and stress. Look at your nutrition, healthy, well-balanced diet, high fat, low carb, vitamin D, zinc, etc. And you need to engage in regular physical exercise to see if this can increase your natural testosterone levels so that you do not need TRT. Seems silly, a doctor who specializes in testosterone replacement therapy telling people he does not want to put people on a therapy that's going to give him money. TRT must only be prescribed if it is in your best interests. I have an ethical code, unlike some, and I will not start you on testosterone replacement therapy unless I feel it is clinically indicated and you have attempted to address your deficiency through lifestyle, nutrition, and exercise. Because even if we start you on testosterone replacement therapy, you still need to address those important aspects of your health. You need to have a holistic approach to everything. We become focused, fixated, tunnel vision. I've got testosterone deficiency, I need testosterone. Seems logical, but there are so many things that contribute to your testosterone production and overall health that we should adopt a more holistic approach, take a step back and be objective. It's really important to take a moment to go, actually, let's reconsider this, let's explore other avenues before committing to what is a lifelong therapy. Reverse your testosterone deficiency through lifestyle, nutrition, exercise, and looking at things like thyroid. TRT may well be in your best interests, but I say to everybody at clinic, you must consider this a lifelong therapy and weigh up the pros and cons. Testosterone is involved. It means daily injections if you come to the men's health clinic, because we subscribe to microdosing, which I've talked about ad nauseum before, so I won't bother again. It's a financial commitment. It's an investment. That's what it is. How much does TRT cost? It's an investment. It's an investment in your well-being. Testosterone suppresses the hypopituitary gonadal axis, the HPG axis. Testosterone is an anabolic steroid. It is not used in the same way for performance enhancement. It is used to correct a deficiency, to normalize your male androgen levels. Even with therapeutic doses, even with microdosing, using the minimum effective dose to achieve the desired outcome, normal levels, you will suppress your hypothalamus and pituitary. If you do not have HCG in your protocol, you will also suppress the Leydig cell function. Whether this is temporary or permanent, it's a bit of a lottery. Anabolic steroids, aka testosterone, is a well-recognized cause of functional hypogonadism, so low testosterone. So when you commit to TRT, you must understand that you should think of this as a lifelong therapy. Now, there may well be circumstances where you decide that TRT is no longer in your best interests. It has not had the desired outcome. What did you want to achieve? This is about normality. This is not about performance enhancement. This is not going to make you Superman. You need to have the right attitude in order to achieve your goal. Fighting and fornicating. That's what it's about. It's about survival. Having healthy male androgen levels will give you the best opportunity to lead a full, active and productive life, only if you have the right attitude. Testosterone is merely the foundation from whence you can build upon and do what you want to do. Super important to recognize that, because some people don't get it. I'm on TRT, why don't I feel amazing? There's a smorgasbord of reasons why you don't feel amazing. Guys with anxiety often rely on testosterone replacement therapy to make them feel better. Can it? Yes. Will it? Possibly. So if you have anxiety, if it's not due to hormone deficiency, testosterone will not cure your anxiety. You need a sense of perspective. You need to understand that so many things influence anxiety, and the negative symptoms that you present with. Do not be so tunnel visioned and focused in thinking testosterone is the cure. It is merely the foundation. So, you've suppressed your HPG axis. Can you come off TRT and recover? The fact that anabolic steroids, and that includes testosterone, is a well-recognized cause of functional hypogonadism, that's your answer. You can, but there are no guarantees in life. Incredibly important to recognize this, but you should not have gone on testosterone replacement therapy unless you had a confirmed deficiency. Going back to the start of this video, you should have explored all the avenues necessary to normalize your testosterone levels without committing to this therapy that suppresses the HPG axis. So if you come off testosterone replacement therapy, you've suppressed your HPG axis. If you're on HCG, at least you have maintained some testicular function, because HCG mimics luteinizing hormone. And also, remember, it's more important than that, there are LH receptors in the brain. So HCG would give you the maximum chance of recovering if you did decide to come off testosterone replacement therapy. But there are no guarantees. This is incredibly important. So when you make the decision, make sure it's a balanced decision. Is TRT in your best interests? Please do not listen to the bozos on the internet. If you think you have testosterone deficiency, do your own research. Don't listen to dogma. Don't listen to things that, or people that promise the world. If it seems too good to be true, it is too good to be true.